What's up, everyone? Welcome to this bonus drop of the Healthcare Wrap. You know, we spend a lot of time talking about how healthcare is not consumer-centered, and we've all seen the pain points and we've all felt the friction. But I realized maybe it's been a minute since we've defined what consumer-centered health actually looks like. And my definition of it has been evolving a bit anyway. So let's take a few minutes and talk about what it actually looks like when we get this right. Today, I just want to paint a picture of what consumer-centered health looks like, and you can think of it like a roadmap or at least some signposts for where we could be headed. Okay, so let's first define it. Consumer-centered health is developing products, services, and experiences that put the consumer's voice at the center. They guide consumers during the 90 to 95% of their lives when they aren't in the clinic, and they have a multidisciplinary view. They combine experience, business, tech, and marketing, like the wrap intro says. Consumer-centered health lives at the intersection of three big areas: patient experience, consumer wellness and preventive care, and the digital front door. Now, undoubtedly, we've all heard those terms, and maybe in different contexts, but when they come together, that's when things get interesting. For instance, imagine a next-gen digital front door that's not just a patient portal that frustrates you with 14 passwords, but it's an actual seamless entry point into care. Or imagine it being a wearable with the plethora of new information and insights that are offered to you without even needing to see a doctor. Then there's next-gen patient experience, where showing up doesn't mean filling out that clipboard with the same info for the 10th time. Come on, people, let's kill the clipboard. There's such a difference between that and those experiences where the care team already knows your story, respects your time, and communicates with you in the way that you want to communicate in real time. And then on the consumer-led wellness and preventive side, this is stuff that you actually choose to engage with. That's one of the main differences between sick care and well care. We're talking about fitness, nutrition, sleep, stress management, and metabolic health, all those things that make up that 90 to 95% of your life when you're not a patient in the system. So that's the key here. Healthcare isn't just about the 5% of our lives when we're actively sick or sitting in a clinic. Consumer-centered health means being a trusted guide for the rest of your life. And let's not forget, this isn't just about care delivery. It's about business, technology, and marketing. It's actually about designing products and services with the consumer's voice at the table, which, let's be real, that still doesn't happen nearly enough. Okay, so we've defined it a little bit better, but what does this look like in the real world? Let me give you 8 examples. First, hospital at home programs. Most people would rather not stay at a hospital any longer than they need to. Now, hospital at home care does come with plenty of challenges, but it addresses one of our most significant desires: comfort and familiarity. Second, direct primary care. A subscription model where you actually know your doctor and they know you. Plus, there are no surprise bills. There's just access and trust. Unless you still think this is still on a concierge medicine level that's only for the rich and famous, DPC is actually one of the most affordable methods of primary care in most areas. So it offers predictability and affordability. Third, retail health. We're down to only a couple of players left on the board here when it comes to big retail making investments in healthcare, but those that are still around, think CVS, Amazon, Albertsons, and to a smaller degree, Best Buy, they tend to be able to execute on transactional aspects of healthcare that focus on ease and convenience of retail consumer relationships. Fourth, food as medicine. This one's pretty simple to understand. It's health plans covering groceries based on nutritional scores, and it's one of the simpler examples of health that's focused on both sickness and prevention. Fifth, connected fitness and wearables. I mentioned that these are likely the new digital front doors in my mind, so the latest generation of your Oura Ring, your Apple Watch, your Whoop band, and related devices give you data as well as context for what that data means, all without the hassle of scheduling an appointment at all. Sixth, functional medicine and wellness services. It's interesting to see the rise of more subscription-based and health system-based programs that work to get to the root cause and not just throw a pill at the problem. Seventh, experience orchestration. In order for you to want to engage with your health system between visits, they have to make it worthwhile and easy for you to do so. Is there a patient portal on the planet that's worth engaging with on its own for more than a quick glance at your upcoming appointment or test results? I mean, not that I know of, but when health systems implement experience orchestration, they connect to all the digital touch points. Lab draw, bill pay, digital weight loss program. Now they're all in one place with one login. In my mind, health systems simply can't say they're actually providing a consumer-centered experience without this. And finally, metabolic health programs. Whether or not you like GLP-1s, the reality is they're the starting point for more health and wellness journeys than anything else on the planet right now. And when you combine digital prescribing of the medications with virtual visits, health coaching, and support communities, they offer an alternative to the shame-filled paths of legacy weight loss offerings and those pointless exams exam room encounters where the doctor tells you to eat better and work out more, but then doesn't see you for 12 months. And let's acknowledge, now that Serena Williams has shared that she lost 31 pounds using a GLP-1 drug, let's just say it's pivoting the conversation and causing some to reconsider their opinions. After all, that's what happens when an Olympic gold medalist and one of the most well-respected athletes ever enters the chat. Now, these offerings all look different, but they've got some common DNA. Think about it. They're accessible. You don't have to jump through hoops. They're transparent. You know what you're paying for. They're personalized. They truly meet you where you are. They're proactive, focused on keeping you healthy, not just patching you up when things fall apart. And most of them bridge the gap between sick care and well care. That's what makes them consumer-centered. All right, now finally, let's flip it around really quickly. What does not qualify as consumer-centered? Because there is plenty of that still going around. Now, this might focus more on experiences, but let me just give you some examples. These will likely resonate with most of you. Asking patients to fill out clipboards at the beginning of every visit, the fee-for-service hamster wheel, not knowing the price of your service until after the bill arrives, inconvenient scheduling, long wait times, doctors loving having their schedules booked out for weeks and months, systems that don't talk to each other, pointless portals, and limited communication channels. In short, anything that creates friction, confusion, or lack of trust, that is not consumer-centered, folks. And wherever our starting point is here, that's what we need to work to improve and evolve. So here's the takeaway, everyone. Consumer-centered health is about weaving together patient experience, preventive wellness, and digital innovation into something that actually feels designed for humans. It's about asking yourself, is this product or service really built around consumers, or is it just healthcare with a shiny new app slapped on top? And it's about rewarding the models that do put consumers at the center so they can scale and become the norm. We don't talk enough about that, folks. So here's my challenge. The next time you interact with the healthcare system, ask yourself, does this feel like it was designed for me as a consumer? If not, what would it take to get there? That's the conversation we need to keep pushing, and that's what consumer-centered health looks like. I hope you enjoyed this, everyone. Let me know if you'd like to hear more bonus episodes like this. And don't forget to visit healthcarewrapcommunity.com to create your own free account for our new community, the only place to connect with fellow leaders and innovators who are bridging the gap between sick care and well care. That's healthcarewrapcommunity.com. Thanks, and we'll talk again soon.